First thing we're going to talk a little bit about what we do is diet. Obviously, everybody knows that if you have 20, 30 extra pounds on, it's going to increase your risk of heart disease, diabetes, but more interesting is that women who have increased belly fat have a much higher risk of breast cancer. So, this was something that I looked at and I thought, I need to find something that's safe, effective, and works with your body, metabolism, to actually create the weight loss that's appropriate. So we're going to talk a little bit about our diet that we use, the Hcg diet. Most patients that come into me, they basically say they have come out of similar issues. They start on a diet, they get all revved up for it. The first week they lose a few pounds. The second week it starts to kind of level off. They finish the diet maybe a month or so later, they get frustrated, and then the weight rockets back up. There's a reason why, metabolically, there's a reason why this occurs. The reason is that when you basically are eating less food, you actually start going to starvation mode. So your body actually starts breaking down muscle. When you break down muscle, what that does is actually lowers your metabolism. And so when you're lowering your metabolism, as the diet goes on, the weight stops going away. The Hcg diet's different. It's a hormone that actually targets brown abdominal fat. So the type of fat that's usually very stubborn to get rid of is the first thing that it gets rid of. So when you go on the diet and you start the low-calorie diet, you actually, the first thing is that your metabolism starts to go up, because I'll show you a nice little picture here, basically showing the difference between losing 5 pounds of fat and 5 pounds of lean muscle. You can see they're much different. So in this case, when you start losing the abdominal fat, besides for the fact that it decreases your risk of developing diabetes and heart disease, which I'm very interested in, but also it actually raises your metabolism. So what we find with our patients is that the people actually increase the amount of weight loss the second, third week of the diet because their metabolism starts rising up. And then once the diet's over, you've effectively switched your metabolism. So when you go off the diet, you go to a sensible kind of diet and you don't start gaining the weight back. In fact, you'll continue to lose weight because it actually effectively raises your metabolism, where other low-calorie diets will lower it. So that's the reason why I chose the Hcg diet, because it actually really works. So basically the diet is daily injections of the Hcg hormone. Now, even my most needle-phobic patients all say, the needles are thin, they're small, they're no big deal. So it sounds scary initially, but the needles, what I'll show you a picture of, are very tiny. But basically you have either a 23-day program or a 40-day program, and we evaluate your needs, what you need to do to try to get you the best sense of what is best for you. So that's pretty much what, the thing, and these are some of the results that we've had. One of our happy patients, what we found for the most part is people lose up to 1 pound a day, over the course of the diet. So over a 23-day course, 20 to 25 pounds. Over a 40-day course, this is, a patient that lost 41 pounds in 40 days. And it's also safe for guys too. So basically, Hcg, which is, a hormone that occurs in pregnancy, but you're not pregnant. The amount of hormone that you get is 0.125 units compared to 80,000 units, which you have in pregnancy. So it's not causing you to be pregnant or anything like that. But what it does is it actually targets the brown fat and actually fixes your metabolism. So the important facts about Hcg, which I'll talk about, is that a lot of times you'll hear about the oral drops. They sell them at the health food store. They don't work because they go through the liver, they metabolize wrong, and they don't actually function properly. This is not HGH, which a lot of people get confused about, which is human growth hormone. It's Hcg, which is a natural hormone in the body. And it's effective because, in fact, it targets the abdominal fat and it actually raises the metabolism. So we find that this is really the most effective, this is the most effective diet that I looked at. I looked at a whole bunch of them before we started deciding which would be best, because weight loss is a big problem for a lot of people, and it's an important problem because it really affects your overall health. And that's the thing that I'm most interested in, making sure that people are the most healthy. So,